Hello, I'm Pauline, your neighborly nurse practitioner. I want to talk to you about blood work. I often hear patients say they don't understand what they're looking at when they look at their blood work. And they also feel as if sometimes providers do not take the time to explain what the numbers are saying and what the numbers mean. So I'm going to do that tonight, debunk some of the mysteries. So, basic blood work. I'm going to start with the CBC. What is a CBC? The CBC means your complete blood count. Now, you have different types of blood cells. We have white blood cells, red blood cells, and we have the platelets. And that is what the CBC accounts for. So for the white blood cells, there are what we call differentials, meaning subcategories of white blood cells. And they each can tell us something specific about what's going on in your body. When we look at your white blood cells, we are looking to see, do you have an acute infectious process going on? And at a basic level, we're just looking to make sure that numbers are within their normal range or acceptable ranges. And for some persons, acceptable ranges can be outside of normal range, because if you have an established illness, it may mean that your acceptable range is outside of a normal range. But for the status quo, all things being normal, when it comes to your white blood cells, we're looking to see if you have an infectious process going on. We're looking to make sure that your numbers are not outside of normal ranges that could suggest that you have a pathological process going on or some kind of disease process brewing. In addition to your white blood cells, we look at your red blood cell count. Your red blood cell count tells us a few things. And like I said, the basic normal range we look at to make sure everything is okay. Once things are outside of their normal range, we look to see, are you anemic with your red blood cells? We look to see the color, the size, just making sure everything is all right. So the red blood cell numbers, the red blood cell has associated indices with it. Your hemoglobin, your hematocrit, the size, the color, their distances from one another, and so forth. That's what we look at when it comes to your red blood cells. For your platelets, we look to make sure, again, within normal range. If it's too low, then it could suggest that you're prone to bleeding. And if it's too high, it could suggest that you're prone to at risk for blood clots. And if things are outside of their normal range, then we want to be sure to understand what is causing it to be so. Okay? So as far as your CBC is concerned, things that they can tell us immediately are you symptomatic for certain things? If you come and say that, oh, I feel tired, or I'm having a fever, or I'm having fatigue, I can't sleep, things like that. Look at your CBC and see what it's telling us. Are you anemic, or are you having an infectious process? What are your numbers telling us? Also for your platelets, are they too high? Are you prone to blood clots, or are you prone to bleeding? Based on whatever symptoms you're experiencing, we can tell from your numbers. Hope that helps. On my next video, I want to explore the complete metabolic panel. See you then.